Hi, I'm Coach Paige with Infinity Health Coaching, and this is an Obturator nerve glide. We're actually going to be moving through a series of movements to help us unlock tension and tightness basically in the hips and in the lower body. And whenever we're doing nerve glides, or what's also known as nerve flossing, we're not looking to do static holds. We're looking to do some sort of dynamic movement, which actually helps to free up the nerve and decompress so that we can get more blood flow, more oxygen to a particular area. That being said, we also don't want to overdo it and do too many repetitions. So please be mindful of the prescription in terms of how many reps to do, okay? So the first thing we're doing is we're setting up in a half kneeling position, one knee down and 1 foot forward. So from here, we're gonna make sure that we have a slight tuck of the tailbone. That is to scoop the tailbone under, or to think about like a tail of a dog tucking it under if they were in trouble, okay? So keeping that static position of the hips, what we're gonna do is practice chin tuck. So we're doing what's called flexion of the cervical spine. So I'm gonna chin tuck to chest, almost as if I'm shaking my head, yes, and I'm gonna perform 5 to 8 repetitions, just like this. So keeping static in the hips, and the only thing that happens to be moving is the head and neck, okay? Now what I'm going to do is I'm going to open the gate. So now I'm taking that forward leg and I'm opening out to the side. I'm still trying to maintain my hips sort of, or at least this front hip here, directed forward, while this one's kind of opening up, okay? And so from here, what we're going to do is shift our weight slightly towards that open foot. Again, we're going to keep that tail in tucked position. And now what we're gonna do is being able to rotate the thoracic spine. So now my sternum, and I'm trying to almost bring my belly button and bring it towards that front leg. And again, I'm going to tuck the chin to chest. And then I'm gonna reset. So the movement is rotation with a chin tuck. Chin tuck, rotate. And again, no more than 8 reps is gonna be good for this position, okay? So let's do this again, do it on the other side. Sometimes what's kind of nice is we can actually just generally incorporate some mobility. So maybe some of my clients have done this with me in person. We might have done some pelvic tilts. So sometimes it's just nice to actually just move the pelvis front to back, kind of checking in, even noticing what happens when you do that tuck tail position. So let's look at it from the side so you can see a side view. So this is me kind of going to do what's called an anterior pelvic tilt, these little like scoop-like movements. And again, if my tailbone is here, right now my tail is flying high like a kangaroo, so my tail is pointing up towards the ceiling, and that's called an anterior pelvic tilt. And then I'm gonna tuck my tail and scoop my tailbone under. Now my tail is tucking in and down, and that is called a posterior pelvic tilt. So again, we're gonna keep that position of the hips of that lower body, and then we're just gonna do 5 to 8 chin tuck to chest. Really just only moving and mobilizing the neck and head. And then the second component, as I showed before, is taking that forward leg, taking it out, you know, just so that it's on an angle. So it's not directly forward, but it's not completely perpendicular to the side. It's kind of at a slight angle. And now just here, I can still kind of take a moment to mobilize my hips. I can do some hip circles. That might feel good, but now when I'm ready to do my nerve glide, tuck the tailbone, shift the weight a little bit more towards that forward leg, and again, chin to chest with thoracic rotation. Chin to chest with thoracic rotation. Now, as I do this, it's definitely requiring some effort from my feet, from my legs, from my lower body, so that I don't fall over. So there is going to be a balance component. If you're having trouble with your balance, just go ahead and hold on to something. Slightly touching your fingertips to a box, a bench, or something near you might just help your vestibular system maintain a good feeling or sense of balance. So give those a try. If you have any questions, be sure to shoot me a direct message.